Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to Reproduction's monthly Act and Learn webinar for the month of November. It's our last substantive webinar of the year, and today we are talking about what's going on for abortion rights and access next year. We certainly hoped when planning this webinar that the forecast for the years to come would be more hopeful for a lot of the causes we support than they seem to be. That is not the case, but one of the best antidotes for that is knowledge. So we are hoping to provide that for you today with some excellent panelists. But first, a bit about us. So the first voice you're hearing today is Shireen Shakori. I am Executive Vice President and Chief of Staff at Reproduction. My pronouns are she and her, and I'm based in Washington, D.C. And I'll kick it to Ani to introduce herself.
Hi, everyone. I'm Ani Bennett-Fradkin. I'm the Archival Research Coordinator at Reproduction. I use she and her pronouns, and I'm based in Los Angeles.
Beautiful. So to lay the next hour out for everyone, first we have our intro. That's what's happening right now. Next, Ani will share some grounding information on what's on the menu for abortion rights and access next year, reading the tea leaves a bit and sharing some policy promises from the incoming administration. We'll then go into the amazing discussion with our speakers and provide more info about plugging in with us for future webinars before opening to our Q&A. And if you're listening and want to ask questions at the end, please throw them in the Q&A box on the GoToMeeting platform and we'll be sure to get to you. Just before we get into the topic, though, I'm going to give a brief overview of Reproduction and why we are gathering here today. We are a direct action organization that leads bold action to increase access to abortion and advance reproductive justice. We are proud to be a member of this space, providing a boldly left flank analysis and a strong desire to hold folks on all sides accountable, whether they are traditionally viewed as allies or the opposition. And we also bring to this work a commitment to nonviolent direct action. So I will send it back to Ani to get us started on the topic.
Thanks, Shireen. I'll be going over a few of the key goals we've identified of anti-abortion leaders and groups under the second Trump administration. It's important to note that despite much infighting and disagreement amongst anti-abortion leaders and groups leading up to the election, they are rapidly coalescing now that Trump has been confirmed as the president-elect. Many anti-abortion leaders and groups are already pressuring the incoming Trump administration and newly elected state officials to adopt their model legislation. This includes, but is not limited to, groups such as the Heritage Foundation, which is behind Project 2025, Students for Life of America, and Susan B. Anthony Pro-Life America, which have all already begun releasing statements or reports of what they hope to achieve in 2025. It should be noted that only 16 of Trump's cabinet picks have been named as of this presentation, and they're still unconfirmed by the Senate. That said, we're already seeing ties between Trump's nominations and anti-abortion groups. A number of his cabinet picks have been endorsed by anti-abortion groups, including National Right to Life and State Right to Life chapters, Susan B. Anthony Pro-Life America, and the Family Heritage Alliance. To be blunt, this is neither a surprise nor a coincidence, as Trump had close professional relationships with anti-abortion leaders during his first administration and spoke at the March for Life, which was unprecedented for a sitting president. Next slide, please. Moving now into the actual goals of anti-abortion leaders and groups under the second Trump administration, I'm going to start with government monitoring of abortion care and access. Students for Life of America and Project 2025 want to require government surveillance of abortion care. Anti-abortion pregnancy center chain Heartbeat International recently joined the call for more abortion surveillance as well. Project 2025 specifically calls for every state to be mandated to report exactly how many abortions take place within its borders, at what gestational age, for what reason, the mother's state of residence, and by what method. They also call for the tracking and reporting of comparisons between live births and abortions across various demographic indicators. We know that this type of reporting would further allow anti-abortion leaders, groups, and politicians to endanger abortion seekers and specifically target abortion seekers in communities of color. Next slide, please. Another key goal is the targeting of abortion pills. The majority of Students for Life of America's Make America Pro-Life Again model legislation identifies medication abortion as a primary target. Project 2025 includes 2 pages dedicated to abortion pills and abortion telehealth care. In Project 2025 section on proposed changes to the Department of Health and Human Services, Roger Severino calls abortion pills, quote, the single greatest threat to unborn children. He insists that the FDA's approval of mifepristone and misoprostol, the pills used in medication abortion, was, quote, illegal from the start. He claims pharmacies should have the right to not participate in abortions, including pill-induced abortions, which is to say pharmacies would be able to choose not to fulfill prescriptions for abortion pills. He also states the DOJ should enforce federal law against providers and distributors of abortion pills, which could be used to establish a precedent for the criminalization of abortion. We know that abortion pills are safe and popular. In fact, after the confirmation of Trump as the president-elect, Aid Access reported 5,000 requests for abortion pills in just 12 hours, and Plan C reported a 625% increase in web traffic. Given the need of abortion seekers to access abortion pills, it comes as no surprise that they are being so heavily targeted by anti-abortion leaders and groups. Next slide, please. Ultimately, the goal of anti-abortion leaders and groups under the second Trump administration is to severely limit, if not ban, abortion care and access. Cabinet picks like North Dakota Governor Kristi Noem, who is nominated to the Department of Homeland Security, and South Dakota Governor Doug Burgum, who is nominated to the Department of the Interior, have already severely restricted or effectively banned abortion in their states. Kristi Noem prides herself on being the, quote, first governor in the nation to designate an official in her office to serve as an advocate for unborn children. For Trump, there are 2 paths to a national abortion ban. The first, which Project 2025 calls for, is via the Comstock Act of 1873, an obscenity law which has been interpreted by anti-abortion leaders to prohibit the mailing of anything related to abortion, including abortion pills, but also medical supplies needed by doctors to provide abortion care. Not only would this severely restrict access for those self-managing their abortions, but doctors as well would no longer be able to receive either the necessary medication or tools to provide abortions. We saw an attempt to revive the Comstock Act for this purpose in Arizona in April of this year. The second path to a national abortion ban is more familiar, which would be anti-abortion legislation passing through Congress and then being signed by Trump. Next slide. Finally, I want to touch on a goal that has been rapidly gaining traction, which is to establish fetal personhood under the 14th Amendment. Students for Life of America and Susan B. Anthony Pro-Life America have both made this a goal, among other anti-abortion groups. The president of Susan B. Anthony Pro-Life America, Marjorie Dannenfelser, insists that the long-term anti-abortion goals of the Trump administration must be, quote, centered on the unalienable right to life for the unborn children that she alleges exists under the 14th Amendment. This would pave the way for further bans on abortion, as well as on contraception and fertility treatments such as IVF, and ultimately serve as a critical stepping stone to the criminalization of abortion seekers and providers. With that, I will pass it back to Shireen to begin our panel discussion, during which we'll hear from experts in the field on how to further interpret and resist these outlined goals.
Thank you so much, Ani. I am really happy to present our first speaker, Kimya Forouzan, who is the Principal State Policy Advisor at Guttmacher Institute, where she joined in 2023. In this role, Ms. Forouzan serves as a resource and technical expert on sexual and reproductive health and rights policy in the U.S. at the state level. Previously, she served as Policy Counsel and Legislative Counsel at Compassion and Choices, and prior to that, she was an If, When, How Reproductive Justice Legal Fellow with the National Asian Pacific American Women's Forum. Ms. Forouzan received her JD and MPH from Temple University and her BA from GWU. Outside of her professional work, she volunteers with DC Doulas for Choice as an abortion doula, with Jane's Due Process as a text line counselor, and with the Young Center as a child advocate for Afghan and Iranian migrant children being held in detention. She also serves on the board of Reproductive Health Access Project. Thank you so much, Kimya, for joining us. It's really great to have you today.
Thank you so much.
So our first question, so what are some legal or I would say legislative trends that we should be paying attention to that have already been going on?
Yeah, for sure. So happy to get into those. I think some of the trends that have really been sticking out for us have been, I think a lot of them fall under this umbrella of just greater threats to criminalization. As we know, criminalization of pregnancy outcomes and of self-managed abortion has always existed. There's been kind of greater and greater criminalization as the years have passed. But I think there's also been movement on the state level when it comes to these, and I think there's been new types of legislation that seek to really insert another potential aspect of criminalization, and at times to different actors. So one of those are the abortion support bans. So those are bills or, if they're enacted, laws that seek to add either civil or criminal liability or both to an adult who helps a young person travel for abortion care. As we know, that would really implicate folks who may work with an abortion fund or who may work with a community organization that helps young people, but they may also just implicate someone in a young person's life who's not their parent. And who is helping them. So I think that's one area. We've also seen the area of controlled substances and states' kind of classification of medications. We saw the medications used for medication abortion added to the schedule in Louisiana, which really creates a lot of hurdles for providers and also raises the prospect of potential criminalization because controlled substances are dealt with differently and have, you know, depending on the drug and depending on the classification, have criminal repercussions for distribution, for having them on you. And I think we've already seen some states pre-file bills that hit on that as well already. So that's another area. And then I think another area that we just have had a lot of concern around has been the growing I think expanding focus on just restricting access for young people. I talked about the abortion support bans, but we've also seen a big focus on kind of the quote unquote parental rights movement. So that's obviously also very intertwined with gender affirming care and the restrictions that folks want to put on gender affirming care. But we've really seen that used as you know, kind of the basis or the justification to take away autonomy from young people for a number of things, whether that is attempts at taking away autonomy for contraception, for STI testing and treatment, and many other forms of healthcare, including gender affirming care.
I appreciate you mentioning that. I think something we've seen a lot is how the far right uses things they can do to youth as a test case to make it more palatable to the broader population. I mean, we see that with gender affirming care. We've seen that with abortion. It's just so clear that that is the playbook. So thank you for laying that out. What legal challenges might we anticipate in states where abortion ballot initiatives were passed this past fall, and how might a federal abortion ban come into play?
Yeah, that's another really great question. I think in the states where we saw ballot initiatives pass, it's really, I think, important just to remember that ballot initiatives are this super important step to kind of open the door to challenging restrictions. So there is often a lot that that still kind of needs to happen. A lot of these states still retain restrictions on the books, and so as we saw in some examples of states that that already passed ballot initiatives in prior years, there's litigation that might go into play to remove those restrictions so that you know, either the impact on patients or the impact on providers can be lessened if that restriction is blocked, or if it is eventually just kind of rendered invalid under their state law. So I think that that's one thing to really consider there when it comes to the legal challenges. And I think, again, as we all know, unfortunately, one of the major impacts of these restrictions and bans that we see is really getting at the points of access, and it's never easy to build those back up, even when the law becomes maybe more permissible or is putting less restrictions in place. So I think that's something to also just really be mindful of. There are obviously clinics have closed in states because of restrictions and bans that have been put into place. And even though the law may change, it does take time, really, if ever, for a potential point of access to be rebuilt. So I think there's that. And then I think when it comes to a potential national ban, I think that does raise some really big concerns, obviously, because states have obviously very much restricted abortion, but there have been some states that have made efforts, or their residents have made their voices heard through ballot initiatives to either maintain or restore access. And I think a national ban would obviously, kind of get at all of that. And I think even if there is not a straightforward national ban, there are so many things that the administration can do that would really seek to undercut some of the progress that has been made in states.
Yeah, thank you for that. I think the specter of a national ban was weighing over the previous Trump administration. They weren't able to get their ducks in a row. Compared to then, what are some of the newer factors that are at play in advancing anti-abortion policy that you could speak to directly, and how a federal ban might be enacted through executive action versus legislation or other methods?
Yeah, definitely. So I think one thing that comes to mind is during the first Trump administration, there was such a strong effort behind judicial nominees getting confirmed onto the courts. I think everyone has paid a lot of attention to the Supreme Court, which is obviously of major concern and has caused so many issues since. But there were also a very significant number of confirmations onto the federal courts, which will impact so many things. And I think a new administration coming into that and having that in place as kind of a lack of a check is very significant in terms of pushing forth pushing forth restrictive policies. I think too, we have seen the threat and the reality that discussions around Comstock have brought up, and what that will mean. And I think even if we don't get to kind of a full-on national ban straightforwardly, utilizing Comstock and also doing things like, reinstating the domestic gag rule and undoing some of the administrative actions that have been done can really kind of open this door to chipping away at access so much that it more or less kind of serves the purpose of blocking abortion access in so many different contexts. So I think that's kind of what comes to mind there.
Yeesh. Well, thank you. I really appreciate you laying that all out and answering our questions. If anyone else has questions for Kimya for later, just please drop them into the Q&A box, and I will pass it over to Ani, who will introduce our next speaker.
I'm so excited to introduce Erin Grant. Erin Grant is the co-executive director of Abortion Care Network. Erin comes to Abortion Care Network after nearly a decade of frontline experience working at an independent abortion facility and with a passion for organizational development. Erin embodies an intersectional lens in the fight for reproductive freedom. They are deeply committed to reproductive justice and bodily autonomy in healthcare, and are fierce activists at the local and national level across many different movements, including reproductive justice, racial justice, and prison abolition. Erin believes we must build with many communities to make room for all our complexity and humanity, and so works to build our collective power and collective impact. Erin believes that we will win. Erin, thank you so much for joining us.
Thank you so much for having me, and what a delightful reason to bring all of these people together, even if the topic is a little bit sour today.
Yes. So my first question for you is, what are independent clinics doing now to prepare for future attacks on abortion access and care?
Thank you for this question. And just to ground all of us and everyone who called in, thanks for wherever you are in this journey of learning more. But it's first to say independent abortion clinics provide the majority of abortion care in the United States. And so since the overturn of Dobbs and in this election, we've really seen the outpouring and just the truth around the fact that most people trust their neighbor, they want abortion access in their community. And the reality is that even before Dobbs or the loss of Roe, it's really hard to be an independent clinic and operate in this country. And we know that we have survived 4 years of devastating blows to our human rights and health and public health access. And that doesn't have to do with who is elected into office. It has to do with the hundreds of bills and bans that our communities navigate every year. And those numbers are just going up. So I want to go back to what Kimya mentioned, which is that at Abortion Care Network, we track clinic closure and the impact it has on the landscape. And so one of the things is staying open. Clinics are staying open to the best of their ability, but when abortion clinics close, they don't reopen. There's a small amount that have the opportunity to do that. And so we know that independent clinics are nimble, resilient, they're really focused on providing the reproductive health care that their community needs, and they're vital. But they need financial support to not just do abortion care, but to keep the lights on, to fight the legal battles that are coming. We are facing laws from the 1800s. Very hard to interpret how these are working in the modern era. So when we say what are they doing to prepare? Well, they are prepared. They're on the inside of this. And in order to face this moment, they're really using their clinical skills, their dedication to their community, and being plaintiffs in cases and providing the care no matter what. So we're really proud at Abortion Care Network to be the home of Keep Our Clinics, which is the only public fundraiser to support independent abortion care providers, not to pay for abortion, but to help them actually survive these moments. So right now, they're providing care up to the legal limit where they can. They're navigating out-of-state abortion services. They are gender affirming healthcare providers, so they have to sit through multiple bans on the life-affirming healthcare that they provide. They're harm reduction specialists, and they're serving as plaintiffs in the upcoming legal battles that we have across our country. So they're super busy, but the first thing that they're doing is abortions, where it's possible and when it's possible, and to the legal limit.
Thank you so much for that grounding. And I think that really beautifully frames the next question, which is kind of a continuation. What can the reproductive health and reproductive justice movement learn from advocates in states where abortion has already been severely limited or banned altogether? And what can still be done in states with heavy restrictions?
So the first thing that always has to be said is that abortion, we focus on a clinical abortion, but abortion is not owned by anyone. So abortions are happening. And so what can we learn is that independent clinics are here to serve to the best of their ability, and they want our support. They also want our communities to understand that once a clinic is in a state of closure, that it's never going to happen again. So once we get to bans that are talking about not having abortion clinics at all, not being able to seek those services at all, we are in a position where it is nearly impossible to reopen those clinics. So we can learn about funding models that assist with general operations, that allow clinics to be the plaintiffs in their cases. We also have learned that they don't see themselves as haven states for abortion access, the places where there's less restrictions. They see themselves as human rights defenders. Every clinic, whether it's in a state that we consider friendly or a state that we consider hostile, every abortion provider faces violence, harassment, state-sanctioned barriers. So things that we can learn are back to kind of the places that Kimya and I are really sharing a lot of synergy, which is that there should be no crime or criminalization attached to healthcare. And in shield states, we've been able to see that happen for providers, but we still haven't gotten to the place where we're able to say no one seeking healthcare or providing healthcare should be criminalized. So they need support and funding, and I feel like we're all learning about the power of public funding, general operations, but we also need to listen to their leadership and expertise, as they are the ones that are providing the clinical services, that they don't want their patients to be criminalized. They don't want to further criminalize or collect data on their patients that is going to be used. And they also want their expertise to be trusted when they say they don't believe, just like the World Health Organization says about abortion, that there's any need for any medical restriction on this incredibly safe healthcare. And that goes for transgender and queer healthcare as well.
Thank you. And I really appreciate that you brought up, I think you said nobody owns abortion. And I think that is such a powerful statement and can segue into this final question for you, which is, what disinformation have you seen about the implications of a second Trump administration on abortion access, and who or where is it coming from?
So the biggest disinformation that we hear from a hostile administration is that if we put into law a federal ban, that abortion will stop in this country. And that's just inaccurate. Abortion has existed, it will exist with and without us. Clinical services have been decimated through tactical, legislative, bureaucratic methods. I think that the devastation under Trump actually started through Biden. And we saw the loss of Roe under Biden. And that's not to say that administrations aren't meant to be held accountable, but really our state legislators, our local movements have shown us that everyday citizens, everyday voters really believe and trust that their neighbors deserve the opportunity to get healthcare in their own community. So we see things like a Project 2025, and people are very upset, and we are too, but we understand that this has always been the goal. The goal has been threats of criminalization, increased violence for anyone who seeks healthcare in a demoralizing work setting for clinicians. We believe that anyone who wants access should be able to get it. So one of the implications that we're seeing is people being forced to travel. We're seeing abortion providers under constant stress. And that misinformation, that chilling effect about you can't get an abortion in the United States has been really the highest peak of misinformation. There's awesome groups like I Need an A that will get you to your closest clinical provider, that will help with those costs. I think we look to our partners like Guttmacher, like If When How Helpline, if someone needs legal access support. We also know that this is going to be not a quick burn. So even if there was a federal ban, there's going to be massive issues with enforcement. And that enforcement is really going to lead to criminalization of everyday pregnant people. So misinformation, I would say, is hard to deal with, but having a steady place to send someone who's looking for abortion care, like ineedana.com, really making sure that you understand the policy information if you're working in advocacy, and also being honest that the World Health Organization has said there is no legal restriction on abortion, whether that's for young people, whether that's for gestational limits, that is appropriate for our country to be enforcing. So when I think about misinformation, I think about people saying that abortion needs limits, that you should only be able to get an abortion if you're this kind of person. And the truth is that no one owns abortion, and abortion, reproductive health access, and having safe families is for everyone. It's for everyone. So that's the biggest disinformation that I see, is that there's a certain kind of person who's seeking it, or it's only for this, but it actually is for everyone.
Thanks so much, Erin. And I will pass it to Shireen to introduce our next panelist.
Thank you both. That was stirring. All right, next we have Rachael Lorenzo, who is a queer non-binary parent of 2 and lives in Albuquerque, New Mexico. They were born in Las Cruces, New Mexico, to young parents and were raised on their father's ancestral land in Laguna, New Mexico. Rachael graduated with a BA in political science and a master's in public administration, focusing on public health. Both degrees are from UNM. Rachael studied political campaigns, participated in policy analyses, and has been consulted for their expertise in public health policies that could impact Indigenous communities. Rachael was not only raised on traditional values, but also on politics. Through their academic career, Rachael volunteered for political campaigns ranging from city council elections to presidential campaigns. Rachael was selected as a fellow for President Barack Obama's 2012 re-election campaign, OFA, and currently funds abortion through Indigenous-led reproductive justice organization, Indigenous Women Rising, as well as serving as Assistant Commissioner of Cultural Resources at the New Mexico State Land Office. In their spare time, Rachael writes short stories and poems, is a photographer, and tries to adopt cats without their husband finding out. I missed that part when I first looked at the slide deck. Thank you so much for joining us, Rachael.
Thank you.
So first question for you. We obviously know that Roe didn't protect abortion access and reproductive care for everyone who needed it. How has Indigenous Women Rising fought to increase access to sexual and reproductive health care for Indigenous communities, specifically regarding emergency contraception access? And what can others in our shared movement space learn from your work?
Yes, thank you for that question. We've worked not only to increase access by distributing contraceptives and education about our bodies, but also figuring out how to couple distribution with storytelling. And so I really look towards folks like Renee Bracey Sherman and We Testify to see how they are using storytelling as a tool to destigmatize abortion and ensure that their storytellers are safe. And so when we're in communities and giving out condoms, giving out the O pill or emergency contraceptives, we're making sure that we have the experience, or that there are people there who can speak to their experience and let our relatives know that that these are completely safe, that abortion is safe. And so those things have to go hand in hand in order for it to be effective, because it also builds trust. And we've slowly started including interns, mostly high school interns, who are absolutely brilliant to do peer-to-peer support and education. So for example, we did a few presentations with the parent group at Santa Fe Indian School in New Mexico, and we talked with parents and their students about how their bodies are changing and what consent means. And so it really is just figuring out what works for your community. I don't think there's a one size fits all, but I really do think there's something that we can learn from each other and adapt these tactics for our own work.
Thank you. Learning the facts and the tactics will get us through this. So with what we're reacting to today, generally what's to come in abortion rights and access, largely shaped by the last election, we're seeing that white supremacy culture was on full display, as it is in a lot of politics. So I want to know from you, how have we and how can we continue resisting white supremacy and the ongoing influence of colonialism in healthcare?
I have to give all the props to Black organizers, Indigenous organizers, immigrant organizers, trans, disabled activists over the generations who have taken on the risk, the personal, financial, professional risk, and I'm about to talk about how we can resist white supremacy, but I just want to acknowledge that how we have been able to protect our communities is those from the most marginalized communities risking it all. And how can we resist white supremacy is who needs to help us bear that risk. I had such a good time with Erin. I love you, Erin. Dreaming and scheming and learning, and something that just became so clear is that we really need those with institutional power to share the risk with us, and that includes healthcare providers, attorneys, anyone with some kind of institutional power to share that risk with BIPOC communities. And this is my interpretation or understanding of some spaces that I've been part of recently. To me, it's always been unfair to expect Black, Indigenous, POC communities and families to speak up and take on fighting for change. And just because something is legal doesn't mean it protects everyone, and it doesn't mean that something is inherently good just because it's legal. And so we really need allies with institutional power to become accomplices, again, like doctors and lawyers, for example, and get brave about supporting those of us who cannot rely on the traditional white people institutions like the court systems or like elected officials and legislatures to make sure that the helpers in abortion access continue to be able to do the work we need to do. I also feel very strongly about this, and I've said it before, I'll say it until the day I die. Roe is not enough. It will never be enough. It was definitely not enough for Indigenous folks. And so we need to stop as a movement with the rhetoric that codifying Roe is it. It isn't. If it was never a reality for my people, and it was the bare minimum for non-Indigenous people, why would we go back to the bare minimum knowing it still wouldn't serve the folks who also need abortion access? And so to me, that says, for example, restoring Roe means that non-Native folks aren't important enough to learn from and see how ineffective it was. And so that's just one example of really digging deep in the ongoing conversation about how to fight colonialism in healthcare, and all of the legal institutions in place that upheld it and influence not just policies, but also our rhetoric and the way that our movement sees abortion access. As Erin mentioned earlier, abortion doesn't belong to anybody. There should not be limits on any kind of healthcare. If people need it, then they need it. And it also should not be limited to what groups of people get access, who is more deserving than others. And so, yeah, I think that's one way is doing power analyses to help us figure out where is the white supremacy existing in our institutions, and how can we help spread that risk?
I love that advice. Dig deep and get brave are what I'm going to distill and remember as we go forward into what's next. So kind of an offshoot of that. So we're seeing attacks coming at the state level, federal level, down to municipalities and tribes. How can people organize against these bans, regardless of where they're coming from? State legislation, federal ban, executive action, federal legislation, the whole gambit. What do you see as a parsing of strategies for that?
Yeah, again, it's really, I will always advocate for local action. Think global, and also acting local, because it can feel really overwhelming, I think, for a lot of folks, and a lot of loved ones in my life who are disappointed in the election. This is the first time they've ever been politically active or have really paid attention, and ask questions, because they know our people know politics affects them, but being able to open up and have those conversations and realize, wow, this is a lot more serious than I thought, and then like feeling that overwhelm and hopelessness almost is, I always counter that with like, what can you do locally? What is it you're really passionate about, and how can you use that to educate people in your field or in your community about why politics is important? That being said, Indigenous Women Rising will always track what's happening legally, but our strategy will always be to support our people no matter what's legal or not, because our traditional values guide us to serve our people in whatever way they need. We believe that the United States is how can I say this almost nicely? I would want to see the destruction of the United States, because it is an illegitimate government structure. Native peoples did not consent to this government structure, and we have survived on this land for thousands of years, and we know best how to take care of each other and our land and our resources, and not take more than what we need. And so, I mean, if it was illegal for Native folks to hunt or to go fishing in their traditional areas, even though that's not inherently wrong, it was still illegal. And that's just like one example of how we will always do what's best for our communities, whether or not it's against the law. And so I think there's a both and. We're going to be cognizant of these things, but if we know it's right and people are going to benefit from it, and this is what liberation demands of us, at least for our work at Indigenous Women Rising, we're more concerned about making sure that our people in our community have their needs met. And so I really encourage folks to look locally around them and how they are contributing to making sure your neighbors' needs are being met.
Really, really beautiful. Thank you so much, Rachel, and to all our speakers. If anyone in the audience has questions for our speakers, please do add them to the Q&A box. I see a few already, but more is great because we are coming up on the end. Before we get to Q&A, if you want to plug into Repro Action campaigns, you can sign up for our email alerts at reproaction.org. And our social media handles, we are at Repro Action just about anywhere you can be tagged, including Blue Sky, not too newly, but within the past couple months. And save the date for our next webinar, which will be a little off format from our usual, but it should be a really good discussion with a bunch of Repro Action staff. So hope to see you there. And with that, I will open up the Q&A box. Someone asked up top if we will share the slide deck afterwards. We don't send out the deck, but we do share the recording of this entire broadcast, which will be on our YouTube channel, hopefully tomorrow. Next. Oh, yes, this is an important fact check. We got North and South Dakota switched, Christy Noem of South and Doug Burgum of North. Thank you for that fact check. We are nothing if not beholden to the reality of the moment. Next question, is there a program to becoming an abortion doula you can recommend? I think a lot of them are localized, but I will open this up first to Kimya, who I know helps run an abortion doula collective. If you have anything to say on that, Kimya.
Yeah, I do. I think it's largely dependent on where you're located. And I know also there are many clinics that have doulas on staff, and so that's kind of a different model, which I think so I think it kind of depends. I think where the need is depends on where you are. I will say from my perspective, I help run DC Doulas for Choice, and we are volunteer based, and we are in the DMV. So our scope is quite limited because we are volunteer based, and we we only work with a couple of clinics as a result, which is a limitation when you're volunteer based. But I think you can email us if you are in the area and are interested. I unfortunately can't really speak to other collectives in other cities because I don't know the specifics around them.
Oh, good. Rachael or Erin, do you have anything to add on abortion doula collectives, programs, networks? And no is okay.
I don't. I'm so sorry.
That's okay.
Yeah, I think this is Erin, and often people come to abortion doula services through activist organizations like your local fund. I think always if you're looking to get involved, go on ineedana.com because you're going to need to give that to a friend who may be pregnant. But you can find your area clinics and funds, and you can reach out to them and say, I want to get my hands in here. How can I help? And they'll get back to you.
Yes, plus upping the plug for I Need an A. They are brilliant, factual, meticulously frequently updated. I Need an A is great. I became a full spectrum doula through the New York Doula Project. I highly recommend their programming. And they do have some materials available no matter where you are. One of the first and best resources you can go to is their DIY doula zine, which you can find PDFs of on their website and print copies of elsewhere in the world sometimes. Next, how can we ensure good information is reaching vulnerable communities, such as I Need a May, for example? I will open that to the floor. Good information instead of mis and disinformation.
This is Rachael. I think that is such a good question. One of the few things I would offer to at least be mindful of to make sure that information is getting to where it needs to and that it's medically accurate is, which is kind of what IWR does. And so if there's a way we can like shorten it down or put it in like a very concise, like few sentence thing, and put a resource, like it's so helpful for us as abortion funds to be able to share resources. Also making sure that if it's online, especially for rural communities like reservations, like any other rural community in the United States, making sure that it doesn't take forever to download, so making sure it's kind of low resolution, so that way people can get the information that they need in a relatively quick way because of the digital divide. Not everyone has access to internet or reliable high-speed internet, and so yeah, I would also offer that as one facet, I guess, to making sure medically accurate information gets out there, because our opponents already know that, and trying to access abortion information in really rural areas like my reservation is actually pretty hard. So we should also think about that.
Super valuable contribution, thank you. Okay, we've gotten actually in the responses some suggestions of others. Apparently, Birth Workers of Color Collective has a great online training. That is awesome. Also, T-Fund, potentially a vow, some local PP chapters. Oh my goodness. There's so many questions, but some of them are responses to previous questions. Okay, sorry. Okay, any suggestions for what to say to shift a discussion in repro spaces from despair about how we will stop doing abortion if it's banned to a combo about how no one owns abortion and we will do the work we need to regardless? Okay, I have things I say with this, but I would love to hear the panel's wisdom. So I think a lot of this is probably about the digging into risk analysis. And shifting perspectives, but I would love to open it up to Erin, Ray, and Kimya.
Yeah, I think one, I believe that people do need time to grieve. A lot has changed. I'm in a generation where every generation of my family has access to abortion, and the youngest generation of my family will not have the same access as my grandmother. It is okay for us to take the necessary time and to not be in problem solving during grief. That's how duplication happens. That's how this thinking of like, I have an idea, nobody else has ever thought of that. That's where a lot of duplication, again, happens, is when we're so quick to fix when we're not tending to ourselves and getting grounded. Abortion has always been, miscarriages have always been, pregnancy has always been. And so I do think that part of helping despair is reminding ourselves that abortion is one outcome of pregnancy, and we are all on an arc of wanting reproductive health, rights, and justice for everyone, regardless of their gender, zip code, religion, race, all of those things. I also think that when we talk about risk analysis, that one of the places that reproductive rights and health has said out loud is that they want to make a commitment to racial justice. And right now is a great time to dig back into the commitment of racial justice before seeking large solutions to problems that will take generations to undo. I heard several of my colleagues say this on this call, but I just want to make it extremely clear that one of the best ways to support ourselves in this moment where we need to be innovative and we need to be disciplined and thinking of short and long-term strategies is to refocus and recenter a broader approach of reproductive justice, which is founded not just for abortion, not just for fertility, not just for pregnancy, but actually is a pathway and a framework that centers racial justice as a mechanism to get us liberated. So I've been really trying to remind people. I heard Rachael, shout out, love you too. And I also heard Kimya mention just really kind of naming that there's a lot of feelings and emotions that are coming up right now that are making it, yeah, so that we're just not listening to people who experience these things. And I just want to plus one to what Rachael said. ineedana.com does not need broadband internet, so get with it.
Love that. Thank you. We don't have too many other questions. We got one asking for good choices for a VPN for better cybersecurity. I would say our friends at Electronic Frontier Foundation or Digital Defense Fund, who have been on previous reproduction webinars, would be a better source for that. I think there's various browsers that have VPNs built in. Brave is one that's been consistently recommended to me and is very user-friendly. For Luddites like me who are not very good at technology. I'm not seeing other questions and we like to be prompt, so I will let everyone go, but thank you, Erin.
Sherry?
Oh, yes.
One more quick thing on
yes.
the tech thing.
Oh, beautiful. Yeah.
Yes, I love this question so very much. I'm a huge fan of NordPass and NordVPN. It's a really affordable way to have a VPN and a password manager. We moved away from LastPass because of who they got sold to. And yeah, I highly recommend them. I also recommend doing some research on various VPN companies like TunnelBear, for example, policies around third-party auditing and their stance on open source material. I say that because third-party auditing, when an auditor who's testing for vulnerabilities or weak links essentially in VPN systems or any kind of cyber safety things, having someone who's an expert in the industry who's not necessarily affiliated with like a funder or part of the company itself can really be beneficial for the company to know what the vulnerabilities are, how to work on them, and then start a plan of how soon those things will be addressed and what they're going to do to address them. So there are lots of great VPNs out there, but that's one way I would kind of help decipher what would be best for you is to look at the third-party audits, or if they even allow, or if they even conduct those. Not every company like a VPN company does that. Signal does it, which is an end-to-end encryption texting app for folks who don't know. So that's one way I would recommend trying to find a good fit for you.
Thank you for that wealth of information. Someone asked to repeat the VPN. I think that was NordPass and NordVPN. And the one I had said was Brave browser, which has a VPN built into the browser. Thank you all again for your wealths of knowledge, for spending this hour with us. Like I said, the recording will be sent out, so anyone who missed this conversation or wants to hear it again can do so. But thank you again. Have a great rest of your Thursday. Bye, y'all.